monkeypox. You know, this is not the first time that we've had monkeypox in Nigeria. I heard the first time was sometime in the 70s, and we've had 2 other outbreaks. So what is it that we're not really doing right, per se?
Thank you. Not just about monkeypox alone. Whenever you have a disease outbreak, it calls to question some critical things. First and foremost, the state of our public health. That's the first thing. Secondly, the challenge of health financing. Thirdly, what is our capability in terms of surveillance to pick disease before they even come ahead? If you look at Nigeria, for instance, like in a year now, we've had like about 5-6 outbreaks of different diseases, from meningitis, cholera, to Lassa fever, monkeypox now. And in fact, we don't know which one is going to come next. So now, you ask yourself the question that, okay, what exactly is not right about the public health system? Now, you look at the agency that's supposed to deal with the public health issues in Nigeria. That's both national agency, National Center for Disease, Nigeria Center for Disease Control, and then you also look at the Agency for Primary Healthcare Development, National Primary Healthcare Development Agency in Nigeria. Now let's pick at Nigeria Center for Disease Control as a start. This agency is supposed to be, the law that's supposed to set it up has been on the front burner since. It has not been passed for more than 6 years. That's supposed to give life to the agency in such a way that the agency will have its own ability to hire staff, recruit staff, strategize, get funding directly. So whatever the agency is doing now is actually either some funding coming from the Ministry of Health, Federal Ministry of Health, or donor people, money being donated from abroad. Now, with that respect, because the first key for you to respond to a public health emergency like this is such that you must have human resources, okay? And then you must be able to hire them, you will have fund to drive those things. As far as that agency is concerned, the agency don't have that life wire. We expect that at the level of the National Assembly, this is something they will pick up and look critically and fast track that kind of law. Now, for every epidemics, in terms of zoonotic epidemics, a jump starts. I mean, the starting point is that when a jump from the host, the natural reservoir, either a wild animal or a domesticated animal, and enter a human being. And then the germ will now rely on human being to spread it from one person to another. Now, the critical area where you need to start stopping this kind of thing is actually to be able to pick those germs in those animals before they jump out from those animals to human. Now, I'm not surprised that we're having the recurrent outbreak of diseases because, again, you look at it, we've just embraced massive agriculture. What that means is that we're going to really meet those animals in their domain, and they're having the germs inside them. So by the time you get involved in more agriculture thing, so in a way you're going to really encounter those animals. Secondly, we've enlarged settlements. Rapid enlargement of settlements. If you can look, let me give you an example. If you look between Lagos and Ibadan, 20 years ago, you knew how the place was, and look at how it is now. So there's a lot of encroachment into those natural resources. There's also the issue of climate change, and to worsen the matter, we still want to have emergency preparedness, in terms of these zoonotic diseases. In other climes, what they do is this: there's what we call future emergency fund, in such a way that there's a contribution where, should an emergency break out, the fund is used to really mop out and stop that emergency before it spread to other people. Now we're having monkeypox. We thank God that's our usual balance, that it's not that deadly. My sister, supposing we're now encountered with a deadly virus, supposing people who are interested in bioterrorism now pick one of those germs, looking at the way it spread, within how many days? We're having how many states? Close to 11 states, 70-something people, under, cases, suspected cases. And it's just moved from Bayelsa, jumped to river, cross river, ran to Lagos, Abuja, just rapidly like that. If a bioterrorist with that kind of organism, we tweak it and send it around, and it will do more disaster than all the noise we'll be making. So, critically, so you sit down and wonder, what are we really thinking about? Is it just come today, discuss monkeypox, come tomorrow, discuss Lassa fever, come day after, discuss epidemic of meningitis? That is not the way to plan public health system. Now, the other critical thing you will see that is missing in our system is such that we're not really having sufficient conversation in terms of, you know, how do I even respond personally? You know, I can sit here and be speaking English. You know, how many people are going to watch you? Those people that watch you probably understand what they need to do. But where these diseases are domiciled, at the local environment, you know, when they're not, the conversation is not getting to them. You are not speaking their language. You are not relating to them. Because these guys, in a way, they need to look for protein. It's even a challenge of food security. They need to look for protein too. And that's why they get in touch with those monkeys. They need to survive. That's why they get in touch with those monkeys or even rodents. Some even use them as food. So we're not, you know, in such a way that at a level of local government, we're having conversation at the local language understood by the people, whereby they will know that these are the risks. If you are going to get involved in farming, these are your risks. If you are going to get involved in expanding your settlement, these are your risks. You know, where you are, if your key job is to hunt, these are your risks. In the language they understand, and then so that at the spark, when the spark happens, people can pick it and then report. Even the reporting system, you know, we thank God for the social media now. If but for that, the thing will have gone underground and, you know, killed many people. And you look at these people where this frequent spark is happening. These guys are poor. They are marginal in terms of nutritional quality. So now, how do you spread epidemics? When you have lack of information, when you are malnourished, when you are poor. So these dynamics all work together to make Nigeria a country of frequent spark among all the negative health indices that we're encountering. A country with, you know, that frequent spark of epidemics is shameful. It shouldn't continue like this.
Okay, so that's well detailed. Speaking from or taking from what you said about awareness, and we have the health sector, we have the federal government to play a role in this. Who exactly is to help push out this awareness? Looking at it that this epidemic is actually from more like the rural area, those who are less educated, who are not informed about this. They only get informed when they are affected. So how do you think awareness should be, how do you think we can spread this awareness? Or who is in charge?
First of all, let's look at who's supposed to drive awareness.
Yes.
Okay. Again, the communication on health should be driven by policy. Okay. Now, if you look at the country, we don't have a clear-cut vision for health, as to say that, wait a minute, in the next 20 years, we should be out of this, out of that, out of that. The rate of hypertension in the country should be like this. The number of people suffering from diabetes should be reduced. We should, you know, your business should not. We are not having a clear-cut, a well-defined, you know, health vision for the country. We might have also other visions, which I don't know. But the truth is that, you see, there's a policy that should be flowing from the federal government and the state, because health is on concurrent list. In fact, federal, state, and the local government can actually do something about it. But more importantly, the federal government drives public health. Okay. The conversation should be flowing from there. And then the conversation should actually, as much as it's broad, it should be local. So in such a way that each state picks it and make it local as much as possible, in a way that the members can understand, the resident of the place can understand. Okay? So that is how you look at it. Now we're talking about local government autonomy. The local government should actually be at the starting point of epidemic prevention. Okay? But the local governments, as you see them, what are they really doing? We're not seeing much happening from their own side. So, one, if we're in this kind of situation, what next? We expect individual, you know, to grab as much information as possible. Yes, you are using this medium to spread information on some key diseases that can really affect people. You understand? You know, but again, individual must really take their health first. Now, we have different NGOs and organizations. We see multiplication of churches. We see all sorts of funny NGOs coming up. You know, we cannot even use those kind of things to drive quality discussion in terms of health. Because if you get to a church, because everybody seems to be so-called religious in the country. So if at that level, we look at it and say that, listen, because, and the church says that we're going to do at our pulpit, even before we start the sermon, this is what we're going to be talking about, the health of the people. Just a short thing. That will sink in. People will take information from there in whatever language and be able to act on it. And, you know, because besides, when the religious group were coming, they brought church, they brought education, they brought health, they brought hospitals. So again, what we have done is that the people have now synchronized and fused everything. Church, you know, they are doctors, they are this, they are the financial, that want to advise you on finance. Also, you know, it's a rec system, with due respect, honestly. So the conversation should be at the individual level, at community level, you know, at with the market women, at with your religious organization and faith-based organizations, and with your NGOs. So this is how, you know, you move, you know, influence across the value chain to reach those people that can actually make the difference in terms of being aware.
Okay, fine. Let us look at one other critical aspect, which is what we actually consume as a people. The other day in the news, sellers of bushmeat and other, you know, proteinous substance were out in the public saying that their bushmeat are really safe for consumption, that it happened before, now it's happening again, that how come it's always affecting their trade. But the thing is that it is something that we should really discuss, you know, because that's one of the ways that people actually get, you know, to get this disease. So what can we really do? Are we saying that we should stay off this bushmeat or maybe monkey meat for now or forever? What exactly should we be doing?
You know, the diet preference of individuals are different. Okay, because even the so-called common bushmeat you can't give me, I'm not going to eat. I mean, no, I'm not talking of monkey meat. But again, that's their diet choice. Now, I think what we should be doing is be entrenching what I call safe food practices. Even if you walk around the city called Lagos and, you know, and you look around, you see food hanging everywhere. You can buy food there, you can buy amala there. You know, the culture of safe food practice is not being entrenched. And at that level, when you know that, well, this is the business angle of some people in the local area, that they kill monkey for me, all you need to do is to be able to put in place a simplified method to ensure that even the consumption of that monkey meat is safe. You know, the process of killing the monkey, you know, preparing it and transferring it to market and even selling it and preparing it is safe. So, I mean, this one will not require any planetary science for you to really do. Again, at the level of local government, instead of them waiting and be harassing people that are having no parking signs or harassing women that is carrying food, they should be able to do something and be useful. You understand? Because that is where the health of the people are domiciled.
Okay.
You know, again, safe food practices can actually, you know, resolve the issues. You'll be able to meet those people that are involved in selling, killing, selling, you know, of those bushmeat, and then put some, you know, simple education. In fact, it could be visuals. You could have some, you know, some stickers, you know, or some posters in strategic places in their market, you know, within their precinct where they can see it. There are even graphic one that they can see and understand what they need to do so that, you know, they don't pick chance from this animal and then spread it to other people.
To humans. All right.
Okay, so still speaking on the case of monkeypox, I'm wondering, knowing that the public health sector and the federal government has, well, let's just say the health sector and the federal government has a key part to play. But then we all know that not just the federal government, we also need medical practitioners, probably the vets. What is their role in this? Because I think if people are not just educated about, it's not just educating people about staying off bushmeat and the rest, if they understand the dealings or how to deal with this bushmeat of a thing, to a large extent, we might save ourselves from future occurrences like this. So what exactly is the role of a vet in this whole thing?
No, yeah, thank you. Not just vet, because the key thing is to actually spot and stop the epidemics before it occurs. And for you to spot it, you have to go to the animal kingdom. It's not, you don't allow it to jump to human before you start, you know, doing what you're supposed to do. You're supposed to be able to pick it even in the animals. And that is where the Ministry of Agric, Forestry, vet doctors, and even the people that are involved in planning in terms of, you know, and even defense, international defense. You know why? Because the ability of this thing to wipe out, it can be an issue of national security, a serious, you know, security threat to the Ministry of Defense, and apart from Ministry of Health. It's a multidisciplinary, you know, issue. When you are talking about how to stop epidemics, you know, from jumping around people, it's a multidisciplinary thing, because the cost, even on the economy could be humongous. So these are the issues. So everybody, and like Riley said, you know,